From WTVG Toledo, Bridges, with your host, Donnie Miller, connecting our community with information about issues and opportunities.
Hey, good Sunday morning and welcome to Bridges. I'm so happy to have you here today. Most likely, the Affordable Care Act has debuted in a city near you, and I have to tell you that Toledo, Ohio is no different. We have three folks here who are our local experts on the Affordable Care Act. They're going to talk to you about what's happening in Toledo, and I'd like to introduce them to you now. You all know Jan Ruma, who is the Executive Director of CareNet, one of the best health care programs in town. We are so glad to have you here, and right in the middle of all of this Affordable Care Act stuff.
Yes.
Yeah, it's an interesting place to be right now.
Absolutely.
Absolutely. We also have Anna Gardner with us, who is the training manager for the Affordable Care Act enrollment program for the Neighborhood Health Association. Welcome, Anna.
Good morning. Thank
Glad
you.
to have you here. And Brad Clark, who is responsible for making it all work in terms of the Affordable Care Act and the enrollment process for the Neighborhood Health Association. Welcome, Brad.
Good morning, Donnie.
So I should tell people that the reason that you all are here is that you all have received money through that very competitive process to facilitate the enrollment in the Affordable Care Act. How's it going overall?
Well, we are getting ready to put feet on the street and help people get enrolled in health care that they're now eligible for thanks to the Affordable Care Act. I can tell you with Toledo-Lucas County CareNet, we have 6 part-time navigators that are going to be serving Northwest Ohio, really outside the Lucas County area, and we're really pleased to be partnering with the Neighborhood Health Association for Get Covered Northwest Ohio, an effort to work together, connect with community partners, and make sure that when people need help knowing what their insurance options are through the Affordable Care Act, that we can make them aware of that.
Can we talk for just a moment? Well, first, how many navigators does the Neighborhood Health Association have?
We have 16 navigators. Our navigators are all trained. We're ready to hit the ground on December 4th. We'll be serving out of 6 different locations. Toledo Public Library has partnered with us. The Source has partnered with us, and we will be in 2 different federally qualified health centers through Neighborhood Health Association at East Toledo Family Center, and we'll be at Cordelia Martin as well.
Yeah, we'll show you all a list of those locations before we leave you this morning. And it's also important to know that as I understand the process, there will be the opportunity for enrollments to occur at special events. So the enrollments not only happen at those stations that you mentioned, but you're going to make sure that they happen all over town. You know, can we help people understand in like 3 seconds what the Affordable Care Act is all about? Anna?
It's all about getting people who never had the opportunity before to have insurance get covered, but more importantly, get the care that they need without waiting until they have to go to the emergency room, to get them care with dignity, so to speak. And I understand there's about 44,000 people in Lucas County alone that have never had coverage before, so they don't know how to get to the doctor prior to their care being an emergency. And so the Affordable Care Act allows them to go online, and the marketplace.gov is the website. There are some extensions to Medicaid, so they may actually be eligible for Medicaid and be assessed eligible for that, and then the Medicaid offices will help finalize that. Or they may be eligible for an insurance policy, and they may have subsidies or not, but the Marketplace website will help them determine what they have available to them, and they'll be able to pick a plan and then actually enroll in the plan, and then if they have a premium to pay, get that premium paid with the provider.
You know, there's been so much discussion, though, about this whole enrollment process, about it being complicated and not really responsive to just ordinary people. Is it as tough as people are making it seem?
I think with, you know, every new thing is always tough, and this is like any new thing. It hit people kind of quickly, and there were some hiccups in there, but the facts remain the same. I mean, over the last decade, we've had insurance premiums double. It's contributing to 60% of all bankruptcies in the United States. I think that's why we're here, Donnie. We're here really to serve, and they came up with the term navigator. It couldn't have been any better. We are here to navigate people through this process.
Yeah.
So if anybody logs on and they have troubles and they run into a screen that maybe they don't know, they're free to call in, they're free to sit with one of us, and we'll kind of help them through the process.
Yeah, and actually, though, people can get through the process on their own.
We really hope that a lot of people will be able to get through the process on their own, and the Navigators are really for those people who maybe have never had health insurance or aren't comfortable using the internet to help them guide through the process. But I think, Donna, you know through our work with CareNet over the last 10 years that people who don't have health insurance live sicker, they die younger.
Absolutely.
And the whole purpose of this is to really kind of carry out that mission to connect people to the health care they need and help them use preventive health care so that they can live as healthy as possible. And I think that Medicaid extension is going to be a really good tool for many people, especially those who qualified for CareNet in the past, to have health insurance that they can rely on.
Yeah, I too want to commend both organizations for collaborating on this huge endeavor, making sure thereby that you are using the resources maximally, making sure that this entire county and outlying counties get covered just by combining resources. So congratulations to both organizations for doing that. People don't really understand that they are seeing benefits of the Affordable Care Act already.
Right.
And they are.
I mean, an example would be children who are now eligible to stay on their parents' health insurance coverage till 26.
Right.
That's a great benefit. Certainly, the elimination of pre-existing conditions are going to come up, and starting December 9th, Lucas County residents and people throughout the state will be able to find out if they're eligible for Medicaid extension.
Yeah, and we need to talk a little bit about Medicaid extension, which most of us were calling Medicaid expansion until last week. But this week it is Medicaid extension. Next week we'll let you know what it is then. But we need to talk a little bit more about that before we go today, because that is a big deal as well, especially for Ohio. It's a really big deal.
Right. For those really who have low incomes, now up to 138% of the federal poverty level. So these are going to be single adults who haven't been eligible for federal assistance before, will now be able to enroll in Medicaid. This is really going to help people stay healthier, because instead of, for instance, pregnant women in Ohio are eligible for Medicaid at 200% of the federal poverty level now through Medicaid extension, they're going to be eligible. So before they get pregnant, they'll have access to health care so they can have a healthier pregnancy.
Wow, that is such good information. One of the things, though, that I really want to make sure we do this morning is to make you all feel confident about who those folks are that will be helping you. This was a much bigger process than hiring somebody and putting them in a chair and teaching them how to get through the enrollment process. And I want to ask Anna just to kind of tell us as best you can and as quickly as you can what that process is actually like.
Sure, Donnie. I'd like to tell you quickly, but it was very involved, and I appreciate the way that the grant was written, because it's more than just sitting on that federal website and doing that training, which that in and of itself was not an easy course to get through. There were 26 modules, 12 exams, pretty difficult, and we had people who didn't make it, but the navigators that we have out there not only made it through the federal course, there were state requirements as well, and within the grant.
May I interrupt for just a moment there? There is a federal license that's required.
Correct.
Is that right? And so getting through all of those folks who are navigators must get that federal license.
Absolutely. And then beyond that, they must turn in that federal license along with their application and get a state certification. So then you can go to the Ohio Department of Insurance and you can see who is a licensed navigator. It's right on that website. And then to add to that, our grant, my title said training manager, but it's also quality improvement. So we're not just going to put them out there and they're done, because this is a live law. It keeps changing. We just learned Friday there was an extension till December 23rd for people to get a January 1st effective date. So I need to sit with my people, watch while they're, I'm quality watching what they're doing with their people, but also continuing the education through a series of emails to say this is what changed this week, and also watching them when they're sitting with the people and role playing with them so that they're very comfortable when they're sitting with a client, that they can answer the questions that come up both on the website. It's very involved when you're on that website. We're talking about income tax type issues plus plan issues. Those are two things that people probably are the most confused and seek the most help out professionally. So we're glad to be able to sit with them and answer questions to help them make their decisions.
So in addition to the federal training, the federal modules, what other kinds of trainings have your folks gone
Well,
through?
we invited in a nurse from Mercy. She did some HIPAA and ethics training. We also have a module coming up, cultural diversity, that's scheduled soon, just so that all of our staff are very comfortable with the diversity of people that they may sit with. We may have linguistically challenged people. We may have people that have absolutely no understanding of insurance, and we have to respect where they come when they sit with us, what their knowledge level is, and just don't assume what they know. We also have had all 7 carriers in Lucas County come out and present their plans, and we had a standard list of questions for them so that we have not only the information the carriers chose to give us, but all of the questions that we had about the plan, so that we make sure we have a very thorough working knowledge of those plans. We've also done a lot of role playing, and so that they're comfortable with just the vast variety of questions that will come up as a person sits down with them. And then finally, we have webinars with Centers for Medicare and Medicaid every week, and as we learn what's changing in the law, we're going to get emails to all of our people so they have educational opportunities ongoing.
You guys also did practice sessions, as I recall.
Absolutely.
As well, where you were out and both you and Brad sat with Navigators and just listened to people ask questions and made sure that the Navigators were answering appropriately. How are you feeling about the ability of your Navigators to...
I'm very confident. They're very excited to get out there. They want that website as functional as possible because they want to help as many people as possible. And I will admit that their talents are very strong to strong. I don't have anybody out there that's weak, I'll tell you that. I'm very confident in them. And for those that I feel that I need to have maybe more quality improvement to get them as strong as they can be, we'll be out there with them.
With them working all the time. So people should feel good about this process.
Absolutely.
They should feel good about it. Listen, we're going to go away for just a second, but I promise we will be right back. Please stay with us.